post-traumatic stress disorder month, and most of us, we probably think we know what PTSD is, and we think probably we associate it with soldiers or veterans, and those are the folks who struggle with it. But there's a lot of research out there that says, look, there are a lot of us who are not veterans or soldiers who are suffering from PTSD as well. A lot of people struggling with it and don't exactly know how to find help or that they even need help. So we wanted to have this important conversation this morning. We're joined by Dr. Balderson with Kaiser Permanente to help us understand more about this issue. Honestly, this is kind of a difficult topic because I think people think they know about it, but I think they don't really. So what exactly is PTSD?
So PTSD is a common mental health problem that people experience after they've witnessed or experienced a trauma themselves. So a trauma can really be anything. So we often think of war veterans, but a trauma could be a car accident, domestic violence, gun violence, sexual assault. PTSD itself doesn't develop for all people who experience a trauma, but some key things to look for are if it's been months since the event and you are having problems with continued coping, for instance, avoiding triggers that remind you of the trauma, or if you are reminded of the trauma, having a strong emotional reaction such as a panic attack, increased fear of your surroundings or increased startle response. Repeated nightmares are very common. So these are things to look out for and maybe talk to a healthcare provider if you're concerned about them.
It is something that I think we do associate with veterans and with folks who are in the military because the trauma is so external and so obvious, I think, in many ways. But it really does impact lots of folks in today's society. Do you think we're getting to a place where we're beginning to understand that?
I think we're getting to a place to understand it. I think there is a lot more research and a lot more compassion to be held out there. I think we do identify mostly with those that experience these traumas that are very obvious, like combat. But we know domestic violence, we know sexual assault. These are common things that go on to impact people. But with PTSD, we often hide these symptoms. People get very good at avoiding the triggers, and they often don't tell others that they're suffering.
How widespread is it today in the U.S., for example?
Yeah, in the U.S., we know about half the population will identify experiencing some type of traumatic event.
Half?
About half the population will identify experiencing a trauma, but not all of them go on to experience PTSD. About 1 in 10 Americans go on to experience PTSD in their life.
That's still a significant number. I mean, I'm sure people at home know somebody, whether they know it or not, who has experienced or is experiencing it. So let's talk about treatment options. How do we find treatment, or how do we help someone in our life find treatment?
Yeah, that's a great question. If you're a veteran, it's the best place is actually the VA. They are the leader in treatment of PTSD. However, as a civilian or a veteran that has private insurance, one of the things to look for is talking to your healthcare provider or talking to your healthcare insurance. They actually will have typically a list of providers that can treat this. As a loved one, you can be open and listen and look for those types of things to kind of cue you that they might be suffering still, and then being open and listening. And if they need help, to give them help to connecting to services, because sometimes they'll avoid that.
I think that is kind of the bottom line, that maybe it was something we didn't talk about in years past, but today we can, and that if you're willing to, with a little bit of help, the help is out there.
Yes, definitely help is out there. And there are treatments that are specific to PTSD and to trauma work. And they're very effective, but it's connecting people to the services that's key. And as I was mentioning, people often avoid because they don't want to think about it. They try to avoid thinking about the trauma. So thinking about getting treatment is something that they don't often go to.
So that would be something that a family member could help with. If someone is avoiding trauma, you could step in and try to help them identify it and then help them find treatment.
Yeah, help them find services. So whether that's through their healthcare insurance or their provider, or if you're looking online, looking for a therapist that specifically talks about treating PTSD. Yeah.
I think this is a really good conversation. Thank you very much for being here. We really do appreciate it. So if you do know someone, please know that there is help out there. Dr. Balderson, excuse me, thank you very much for being here. We appreciate your time.
Well, thank you. I appreciate you guys doing the spot.
Thank you. Let's send it over to